Hello, ma'am. My name is Marcus. I'm going to be the PA student today. It's going to be taking care of you. Is it okay if I can go ahead and do your physical today?
Yes.
Okay, let me just wash my hands. Okay, can you tell me where we are?
The clinic.
Okay, and can you tell me what today is?
It is Thursday.
Thursday. And what time is it?
It is 3:15.
Okay. Patient has good affect, mood, and manner. She has good level of consciousness, no signs of distress, good posture, good dressing, hygiene, perfect speech. I'm gonna go ahead and take the pulse. Pulse is in normal limits. Now compare the pulse bilaterally. Respirations are within normal limits. Patient has good rate, rhythm, and pattern. Now I'll go ahead and check the patient's blood pressure. I'll check the patient's upper limit. Okay, now I'll check the patient's blood pressure. Palpating the brachial artery. Patient's blood pressure is 110/70. Now I'll go ahead and check the patient's skin. Go ahead and hold your hands out. Just checking for texture, temperature, any lesions. Checking turgor. Turgor's normal. No moles. Go ahead and stick your fingers out. Checking for capillary reflex. Okay. Now go ahead and inspect the patient's head. Okay. Inspecting. Everything looks good. Now go ahead and check the temporomandibular joints. Go ahead and open. Go ahead and close. Now I'll check the patient's visual activities by using the Snellen chart. Can you go ahead and read from left to right, starting right here, covering one eye?
It's 983.
Uh-huh.
And then what is it? Upside down?
M3.
3W.
Okay. What about these numbers?
7438
And this one?
95623.
Okay, now switch eyes. And I'll just read the numbers for me. Okay, again?
7438
Okay.
95623.
And this one?
535. I can't really read.
Okay. Cranial nerve 2 is intact. Now I'll go ahead and inspect the patient's eye alignment. Go ahead and remove your glasses. Go ahead and close your eyes. Open your eyes. Go ahead, look up. Look down. Okay. Gonna check the patient's lacrimal gland. Okay. Now I'm gonna go ahead and inspect the patient's conjunctiva, sclera, and cornea. So I checked in already. Go ahead and open your eyes. Okay, I'm gonna check the anterior chamber. So this is direct, consensual, side, direct, consensual. Okay. Now I'm gonna go ahead and check the extraocular muscle movements by using the pen. Go ahead and follow my pen. Good. Now I'll perform a fundoscopic exam by using the otoscope. Correct position and red reflex is identified. Same for the right. Now we'll go ahead and check the ears. Okay. We're gonna visualize the external auditory canal and the tympanic membrane. Okay, other side. Now I'm gonna go ahead and palpate the, inspect and palpate the auricles, the meatus, tragus, and the mastoid process. Now I'm gonna go ahead and perform a Weber's and René's test. So I'm gonna go ahead and hit the bell. Once you stop hearing it, you let me know, okay? Okay. AC is greater than BC in the left ear, now for the right. Same thing on the right side.
There.
AC is greater than BC on the right ear. Okay. Now we're gonna go ahead and perform a whisper test. I'm gonna stand behind you, and you're gonna let me know what I'm whispering to you. Okay. Go ahead and cover your left ear. I'm sorry, your right ear. Oh, no, your left ear says.
Baseball?
Yes. Now cover the other ear. Basketball.
Basketball?
Okay. Cranial nerve 8 is intact. Now I'm gonna go ahead and inspect and palpate the external nose and the nares. So inspecting the nose, inspecting the ears. Okay. Now I'm gonna palpate the frontal sinus. Inspecting the frontal sinus and the maxillary sinus. Now percuss. Okay. Now I'm gonna go ahead and check the patency of the nerves bilaterally. So go ahead and breathe in, breathe out, hold one nostril, breathe in, breathe out, other side. Okay, go ahead and close your eyes and cover one nostril. I'm gonna go ahead and put something on your nose and you let me know what you smell, okay? So go ahead and breathe. Okay, what do you smell?
Cologne.
Cologne, okay. Cranial nerve 1 is, go ahead and switch to the other side. Breathe in, breathe out. Okay, what do you smell?
Hand sanitizer.
Okay, cranial nerve 1 is intact. Now I'm gonna go ahead and perform a nasoscopic exam, checking the nasal mucosal septum and turbinates. Okay. Go ahead and look up. Okay, other side. Now I'm gonna go ahead and check the mouth and pharynx. First we'll go up checking the lips. Now we'll check the buccal-mucosal, teeth and gums. Okay, make a grin for me like this, teeth and gums, good. Now I'm gonna check the uvula, tonsillar pillars, and the posterior pharynx. Okay, now go ahead and stick out your tongue and say ah. Move your tongue side to side. Good. Okay. Go ahead and raise your eyebrows. Okay, put it back to normal. Make a smile. Make a sad face. Puff out your cheeks. Okay. Cranial nerve 7 is intact. Now I'll go ahead and check the patient's thyroid and palpate the thyroid. So I'll go checking the thyroid, inspecting, go ahead and palpate it. Okay. Now I'll check the patient's lymph nodes. We'll start with the preauricular lymph nodes, the postauricular, the occipital, the tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and subclavicular. Okay. Now we'll go ahead and check the epitrochlear lymph nodes. Go ahead and open your hands, arms wide. Okay. Good. Now I want you to pick up your shoulders for me. Down, again, down. Okay, cranial nerve 11 is intact. Now I'm gonna go ahead and inspect the anterior, posterior, and lateral thorax. So I'm inspecting. Everything's good. Now I'm gonna go ahead and palpate the bony landmarks. So we're gonna start with the jugular notch.
This is touch.
Okay, jugular notch, clavicular, the sternum, and then the vertebral prominence. Okay, and then the xiphoid process, so it's like right here. And then the 12 ribs. Okay. Now I'm gonna go ahead and check for tactile primitives. Okay. So go ahead and say 99.
99.
Okay. Now on the back, same thing.
99.
Okay. Now I'm gonna go ahead and auscultate the lung sounds. No, I'm sorry. Now I'm gonna go ahead and percuss the lung areas. So we'll start from back here. Okay, other side. Now we'll go ahead and auscultate on the skin. Start by the back. Take a deep breath. Out. Other side. Out. Again. Side. Again. Again. Okay, now auscultate the lateral side. Again. Out. One more time. Other side. Okay, other side. Good. Now we'll go ahead and auscultate the anterior side. Breathe in. Out. Again. Side. Again. Other side. Okay, now I'll go ahead and pull, we'll go ahead and check the heart. I'll go ahead and pull out the tray. And I'll give proper instructions for the draping. I'm gonna go ahead and inspect the neck. That's supposed to be on the right side. Inspecting the neck, carotid pulses, jugular veins and the pericardium. Okay. Now I'm gonna go ahead and palpate the carotids bilaterally. Okay. Now I'm gonna check for heaves and thrills. So heaves, thrills, heaves, thrills, heaves, thrills, heaves, thrills, heaves, thrills. Okay. Now I'm gonna go ahead and auscultate the point of the skin. So first I'll auscultate the carotid using the bell. My hands are cold. Okay. Now I'll go ahead and auscultate the intercostal spaces of the heart. So we'll start with aortic side. The pulmonary side. That's it. I think that was up to the heart, right?